A doctor's plea. Before it's too late. You may not believe what I'm about to say, but as a heart doctor with decades of experience, I'm begging you. If you're over 40, stop eating this fruit. This isn't internet hype. It's not a trend. It's a quiet warning backed by real cases. People just like you who thought they were eating healthy, but suddenly faced devastating consequences. They were active, had no prior history of heart disease, yet they came into my clinic with blood clots, cardiovascular inflammation, and dangerously high markers on their tests, and they all had one thing in common. They were eating the same harmless fruit. I'll explain everything in this video, and I promise, once you understand what's happening inside your body, you'll never look at this fruit the same way again. So before we dive in, do this now. Hit the like button to support this life-saving content, subscribe to our channel, and share this with someone over 40. It could literally save their life. The surprising pattern in my patients expanded. It began subtly, almost too subtly to catch at first. Over the course of a few months, I started noticing a strange pattern among several of my patients. These were individuals who, on the surface, seemed to be doing everything right. They exercised regularly, followed relatively healthy diets, kept their medical checkups up to date, and had no significant history of heart disease or stroke. Most of them were in their late 40s to early 60s, an age range where cardiovascular risks begin to rise, but where many people are still asymptomatic and unaware of silent changes happening inside their bodies. They came into my clinic reporting vague but persistent complaints, a strange kind of fatigue that didn't go away with rest, a mild but frequent sensation of hot fluttering after breakfast, or occasional dizziness that was easy to dismiss at first. In most cases, their vital signs looked acceptable. Their blood pressure might have been slightly elevated, but not enough to trigger alarm bells. Their cholesterol numbers were borderline but not critical. It was the kind of presentation that leaves you with a gut feeling. Something is off, but the textbook doesn't quite explain what. I began asking more detailed questions. I wanted to understand what these people had in common. Were they overworked? Under chronic stress? Dehydrated? Had they recently changed medications, or were they recovering from infections that might have affected the heart muscle? As I dug deeper, I started analyzing their eating patterns. That's when something peculiar stood out. They were all consuming the same fruit, frequently. Some had it as part of their breakfast routine. Others used it in smoothies. A few even mentioned they ate it on an empty stomach first thing in the morning because they believed it helped digestion or detox the liver. That fruit was star fruit. A beautiful, bright yellow fruit with a distinct 5-pointed shape when sliced. Often praised for its low calorie count and vitamin content, star fruit is commonly recommended in clean eating circles as a healthy snack. But what most people don't know, and what I myself had to revisit in medical literature, is that this fruit, while seemingly harmless, can have hidden and severe effects on the cardiovascular and neurological systems, especially in specific at-risk individuals. To make sure I wasn't seeing coincidences, I began reviewing past case files. I looked into patients who had reported similar symptoms but had not been properly diagnosed. In many of those cases, star fruit consumption was never mentioned, let alone flagged as a concern. Yet the similarities in symptom patterns were too consistent to ignore. I also started ordering more comprehensive lab tests, including D-dimer levels, blood viscosity markers, and kidney function panels. The results were startling. Several patients had elevated clotting factors. A few had mildly impaired kidney function they had never been warned about. One patient, a 52-year-old woman with no major risk factors, showed signs of having had a silent transient ischemic attack, a mini-stroke, without even realizing it. When I correlated the timing of their symptoms with their eating habits, the picture became clearer. These individuals had unknowingly placed stress on their vascular systems by consuming a fruit that contains a neurotoxin not well tolerated by people with subtle renal or cardiovascular vulnerabilities. It wasn't about overeating. Even small repeated doses over time were enough to create the perfect internal storm. Toxin accumulation, kidney strain, altered blood chemistry, and ultimately increased risk for coagulation and vascular damage. What's even more alarming is that starfruit is not a fruit people fear. Unlike alcohol or sugar-laden processed foods, it has no public stigma. It's rarely mentioned in mainstream nutritional warnings. And yet, for a certain group of people, particularly those over 40, its hidden risks can be far greater than expected. The average person assumes that if something is natural and found in a supermarket, it must be safe. But in medicine, we learn that natural doesn't always mean harmless. Some of the most toxic substances in the world come from plants. That's why this pattern among my patients became a turning point for me. It taught me that we need to reevaluate not just what we eat, but how our bodies respond to what we eat, especially as we age. Foods that once worked for us in our 20s may no longer be metabolized the same way in our 50s. Our liver slows down. Our kidney filtration becomes less efficient. Our blood vessels lose some of their flexibility. And in that vulnerable window, something as simple as a fruit choice can become the trigger for a chain reaction that leads to a stroke or a heart attack. From that point forward, I began asking every patient over 40 about their fruit intake, not just in terms of sugar content or calories, but in terms of metabolic load, toxicity, and vascular reactivity. What I found only confirmed what I had begun to suspect. Starfruit was showing up over and over again in patients with unexplained cardiovascular symptoms. And yet, no one had ever told them it could be harmful. That's why I'm speaking out, not to scare, but to inform, because no one should have to suffer the consequences of something they never saw coming, especially when the warning signs were already there, hiding in plain sight. The hidden danger inside starfruit. To understand why starfruit can pose such a serious risk, we need to look beyond its bright yellow skin and refreshing taste and focus instead on what lies within, a little-known compound called caramboxin. This neurotoxin is naturally present in the fruit, and for the general population, in small quantities, it might pass through the body without causing noticeable harm. But in individuals with hidden vulnerabilities, especially those over the age of 40, the story changes entirely. Caramboxin affects the body in two primary ways, neurologically and metabolically. Its neurotoxic nature has been well documented in medical literature, especially in patients with compromised kidney function. When kidneys are working perfectly, they help eliminate caramboxin from the bloodstream efficiently. But as we age, even small declines in kidney filtration can reduce that efficiency, often without any symptoms to warn us. The problem is that many people over 40 have no idea their kidneys are struggling. Their lab results may fall within normal ranges, but their bodies are already dealing with reduced detoxification capacity. So what happens when caramboxin builds up in the system? It starts by irritating the central nervous system. In severe cases, often seen in people with diagnosed kidney disease, it can cause hiccups, confusion, seizures, and even coma. But even in milder cases, especially in those with borderline kidney function or vascular sensitivity, caramboxin exerts a more subtle form of toxicity. It creates low-grade inflammation, disrupts the smooth functioning of the blood vessels, and interferes with the body's natural coagulation mechanisms. That's where the cardiovascular system comes into the picture. When the vascular lining, the endothelium, becomes inflamed, it becomes more sticky. This stickiness makes it easier for platelets to aggregate, for cholesterol particles to adhere to artery walls and for blood to become more viscous. Essentially, the blood thickens. Over time, this creates the perfect environment for clot formation. In people with other risk factors, like hypertension or arrhythmia, this increase in coagulability can be the final straw, triggering a cardiac event or even a stroke. Now, most people don't associate a piece of fruit with this kind of biochemical chain reaction, but that's precisely why it's dangerous. Star fruit is seen as a light food, something you can enjoy without guilt. It's often included in detox diets, breakfast bowls, or health-focused meal plans. Rarely does anyone question whether a tropical fruit could influence blood viscosity or neurochemistry. And unfortunately, the delay between consumption and symptoms can mask the connection. A person might feel dizzy 2 hours after breakfast and assume it was dehydration or low blood sugar, never realizing that the starfruit they ate was already setting off a cascade inside their blood vessels. In several documented cases, starfruit has been directly linked to seizures and altered mental states in individuals with chronic kidney disease, but the risk doesn't stop there. Even people with no diagnosed kidney impairment, just age-related decline or cardiovascular sensitivity, can be affected, especially with regular exposure. The problem is cumulative. A single slice of starfruit may not cause symptoms in a healthy adult, but daily intake over weeks or months can quietly disrupt the body's internal balance. One of my patients, a 61-year-old man with a history of mild hypertension, began drinking a starfruit smoothie every morning after reading about its supposed benefits for digestion. Within a few weeks, he reported brain fog, restlessness, and episodes of heart palpitations. Blood work revealed elevated clotting factors and mildly impaired renal clearance. He had no idea the fruit could be responsible. After eliminating it from his diet, his symptoms gradually improved. But the fact that a health-conscious habit had placed him at risk was deeply unsettling to him. Another woman in her late 40s, previously healthy, experienced a transient ischemic attack, a brief, stroke-like episode that resolved on its own, just days after introducing starfruit into her diet on the recommendation of a friend. She had no obvious triggers. Her imaging showed a small blockage in a cerebral vessel that could have easily turned into a full stroke. Her only recent change in lifestyle? Daily starfruit consumption for energy and hydration. These aren't isolated stories. They're part of a growing body of evidence that shows certain fruits, especially those containing compounds like caramboxin, should be approached with caution by people with cardiovascular or renal vulnerabilities. And unfortunately, because starfruit is not a mainstream concern, most people never hear about its risks until it's too late. That's why awareness is crucial. If you're over 40, and especially if you have high blood pressure, arrhythmia, or family history of stroke, you must begin seeing your diet through a new lens. The goal is not to fear food, but to understand how the body changes with age, and how some foods that once nourished you can now challenge your system in ways you never imagined. The domino effect on your heart. Most people believe that heart problems come from obvious things: fast food, stress, genetics, smoking, or lack of exercise. And yes, those are major contributors, but what many don't realize is that your heart is only as healthy as the system that supports it. That system includes your blood vessels, your kidneys, your liver, and your body's ability to manage internal inflammation. When one piece of that system falters, especially in silence, it begins a domino effect. And when that domino effect starts, your heart becomes the target, even if the original trigger had nothing to do with it directly. That's what makes compounds like caramboxin in starfruit so dangerous. You might not feel anything unusual at first. You might go about your day thinking you're making good choices, but inside your body, a sequence has been initiated, one that slowly builds toward a tipping point. Let's break it down. The moment you consume starfruit, your digestive system breaks it down, and its chemical components, including caramboxin, begin to circulate in your bloodstream. If your kidneys are perfectly healthy, they work hard to remove this compound. But if your filtration rate is even slightly reduced, as is often the case after age 40, the toxin begins to accumulate. The kidneys become stressed, overburdened. And when kidneys are under pressure, the rest of the body pays the price. Why? Because your kidneys are not just filters. They help regulate fluid balance, electrolytes, and blood pressure. When they struggle, these systems become unstable. Blood pressure may spike unexpectedly. Electrolyte levels fluctuate. The body retains more waste products and inflammatory molecules. And here's where the heart starts to suffer, even if it wasn't the original problem. The vascular system, which includes every artery and vein in your body, is highly sensitive to inflammation and toxic stress. When inflammation rises, triggered by accumulated toxins or overloaded organs, your blood vessels become irritated. This leads to endothelial dysfunction, a condition in which the inner lining of the vessels no longer functions properly. It becomes more rigid, less responsive, more prone to developing microscopic tears and plaque deposits. At the same time, the liver, which is responsible for filtering toxins and managing cholesterol, becomes burdened by the biochemical mess now flowing through your system. It begins to produce more inflammatory cytokines, immune molecules that signal stress and dysfunction. These cytokines further irritate your blood vessels and even interfere with insulin regulation, which affects your energy levels and metabolic stability. Now think of what happens when your blood becomes thicker and more prone to clotting in this environment. The heart has to work harder to push blood through inflamed, partially constricted vessels. The pressure increases. The workload increases. The oxygen supply becomes less efficient. Over time, this can lead to hypertrophy, thickening of the heart walls, and eventual heart failure if left unaddressed. But long before failure occurs, the risk of acute events rises sharply. A small clot that forms in this hostile blood environment can lodge itself in a coronary artery and block blood flow to part of the heart. That's a heart attack. If the clot travels to the brain, it causes a stroke. If it lands in the lungs, it's a pulmonary embolism. All of this can begin with something as seemingly innocent as consuming a fruit that your body cannot process properly. And remember, you don't have to feel symptoms right away for damage to be occurring. Many people who experience heart attacks or strokes later in life can trace subtle signs back months or even years. Fatigue, shortness of breath after meals, irregular heartbeat after certain foods, or brain fog that seem to appear out of nowhere. These are not random. They're warnings. One of the most deceptive elements of cardiovascular disease is that it builds quietly. Your arteries don't clog in a day. Your heart doesn't weaken overnight. But each day you consume something your body cannot handle, even in small amounts. You are layering more stress onto a system already working overtime. This is why it's so important to think beyond calories and beyond labels. Starfruit isn't high in sugar, it's not processed, it's not fried. But it interferes with internal processes that keep your heart strong, especially if you have the kinds of age-related vulnerabilities that most people do after 40. So, while it may seem strange to question a fruit that looks so beautiful and healthy on the outside, that is exactly what makes it dangerous. Its visual innocence masks a biochemical reality that your heart cannot afford to ignore. The truth is, the heart is not just a pump. It's a mirror, a reflection of every choice you make, every system working inside you, every silent struggle your body is carrying without complaint. And when one of those systems begins to crack, the heart is often the one that breaks first. Understanding this domino effect and interrupting it early may be the key to not just living longer, but living stronger. Who's most at risk? It might be you. Many people, when confronted with a health warning, instinctively think, "That doesn't apply to me. I'm healthy. I feel fine." It's a common and very human response. After all, nobody wants to believe that a simple habit, like eating a piece of fruit, could be setting off a chain reaction inside their body. But what if the very absence of symptoms is the reason so many people get caught off guard? What if feeling fine is no longer a reliable sign that you're truly safe? This is exactly the danger we face when dealing with conditions like silent inflammation, microvascular stress, and toxin sensitivity. And that's why understanding who's at risk from something as specific as starfruit is not about fear. It's about foresight. It's about identifying the invisible vulnerabilities that become more common as we age, and learning how to protect ourselves before those vulnerabilities turn into something irreversible. So, who should be cautious with starfruit? The answer may surprise you. Let's start with the obvious: individuals with chronic kidney disease or renal impairment. In this group, the medical evidence is clear and overwhelming. Starfruit can be extremely toxic. In fact, hospitals around the world have recorded cases where patients with kidney dysfunction went into seizures or even coma after consuming starfruit. But what most people don't realize is that you don't need to be on dialysis or have a known kidney disease to fall into the risk category. Mild, undiagnosed kidney dysfunction is incredibly common, especially after the age of 40. As we age, our glomerular filtration rate, a measure of kidney function, naturally begins to decline. For many people, this process goes unnoticed. They may still fall within normal lab values, but their body's capacity to clear toxins, manage fluid balance, and regulate electrolytes becomes subtly impaired. Add in a compound like caramboxin, and the kidneys are quickly overwhelmed. This creates a toxic buildup that silently circulates through the bloodstream, increasing the risk of vascular inflammation, neurological disruption, and clot formation. Now consider individuals with high blood pressure, diagnosed or not. Hypertension is often called the silent killer for a reason. It doesn't always produce symptoms, but it slowly damages the lining of your arteries, hardens the blood vessels, and reduces the heart's efficiency. When you combine vascular stiffness with thicker, slower-moving blood, a condition that can result from starfruit toxicity, you're creating the perfect storm for cardiovascular disaster. People with arrhythmias or irregular heartbeat are another group at risk. Their hearts are already struggling to maintain a stable rhythm. When internal toxins or metabolic imbalances are added to the equation, the electrical signals of the heart can become even more erratic, increasing the chances of stroke or sudden cardiac events. Then we have people with a family history of heart attacks, strokes, or blood clots. Even if they feel healthy today, their genetics may predispose them to conditions like hypercoagulability, a tendency for the blood to clot too easily. For these individuals, consuming a neurotoxic fruit that alters the delicate balance of the circulatory system could be far more dangerous than they realize. And let's not forget those who are actively trying to live healthy lives but may be unknowingly choosing the wrong foods. I've seen it countless times. People in their 40s, 50s, even 60s who start incorporating more natural foods into their diet: juices, detox smoothies, exotic fruits. They follow advice from health influencers, internet forums, or even well-meaning friends. Starfruit gets included because it looks light, tropical, and harmless. But for these individuals, especially those unaware of their underlying risks, that daily fruit can become a silent saboteur of their health. Here's the harsh truth: you don't have to be sick to be at risk. You just have to be human, aging, and unaware. And that describes most of us. The reason I emphasize this point with such urgency is because the patients I've seen harmed by starfruit were not reckless people. They weren't binge-eating junk food or skipping medications. They were thoughtful, health-conscious individuals trying to do the right thing. But they didn't know how dramatically the body's internal tolerance can shift after 40. They didn't realize that what served them well in their 30s might now be quietly harming them. If you're reading this and thinking, "But I eat it only once in a while," or "I've never had symptoms," understand this: the danger is cumulative. A single serving might not hurt you, but over time, repeated exposure, even in modest amounts, can lead to the type of buildup that the body no longer knows how to manage efficiently. This is why it's so critical to start listening to your body more closely after 40. Notice how you feel after meals. Track your blood pressure. Pay attention to your energy levels, heart rhythm, mental clarity. If you start experiencing fatigue after breakfast, palpitations during the day, or brain fog that lingers, don't brush it off. These could be subtle warnings that your system is struggling with something you haven't identified yet. And if you do have any of the risk factors mentioned, age over 40, elevated blood pressure, kidney stress, cardiovascular history, then you need to see food not just as fuel, but as medicine or poison, depending on how your body reacts. The good news is, once you identify the risk, you can act. You can replace harmful habits with healing ones. But it starts with understanding the true scope of the risk and realizing that yes, this might apply to you. The SMART swap: fruits that heal, not harm. After everything we've uncovered so far, from silent risks to biochemical triggers, the next question is obvious. What should I eat instead? If starfruit and certain other exotic fruits can silently overload the kidneys, thicken the blood, or disturb heart rhythm, what options do we have that are not only safe but actively protective? The answer, fortunately, is encouraging. There are several fruits that do the opposite of harm. They heal, clean, regulate, and protect your heart and circulatory system. The key is not to fear fruit in general, but to become more intentional about which fruits you include regularly in your diet. Especially after 40, when your body's ability to filter, balance, and recover naturally begins to slow down. Let's begin with one of the most powerful and underrated heart allies in the natural world: berries. Whether we're talking about blueberries, strawberries, raspberries, or blackberries, these fruits are packed with polyphenols, flavonoids, and anthocyanins, compounds known to reduce inflammation, lower blood pressure, and improve blood vessel function. Unlike tropical fruits with high sugar or neurotoxin content, berries have a low glycemic load, meaning they won't spike your blood sugar or stress your insulin response. They're also rich in vitamin C, which supports collagen production and keeps arteries elastic and resilient. Next, let's talk about the humble but mighty apple. Often overlooked because of its simplicity, the apple contains one of the most important heart protective fibers known to science: pectin. Pectin binds to excess cholesterol in the digestive tract and helps escort it out of the body before it has a chance to enter the bloodstream. This scrubbing effect is subtle but powerful over time. People who eat apples regularly tend to have cleaner arteries, more stable LDL cholesterol levels, and fewer markers of systemic inflammation. The skin of the apple, in particular, is where many of its antioxidants and anti-clotting agents are stored, so never peel it. Another fruit that often surprises people for its cardiovascular benefits is the avocado. Technically a fruit, avocados are rich in monounsaturated fats, the same kind found in olive oil, which help lower bad cholesterol and raise good cholesterol. They also provide potassium, a mineral essential for blood pressure regulation, as well as vitamin K, which supports vascular integrity and blood clot balance. Unlike starfruit, which can aggravate renal and neurological pathways. Avocado helps calm the system, nourish the heart, and improve the texture and fluidity of your blood. Let's not forget the purple grape, especially those with seeds and dark skin. Grapes are loaded with resveratrol, a compound that has been widely studied for its effects on blood vessel dilation, antioxidant protection, and lifespan extension. Resveratrol improves the flexibility of arteries, enhances blood flow, and helps prevent oxidative stress, one of the key triggers of arterial plaque and clot formation. Even moderate consumption of grapes, or high-quality, unsweetened grape juice, can lead to measurable improvements in circulation and endothelial function. Now that we know what fruits are supportive, it's just as important to consider how you eat them. Many people, with the best of intentions, eat fruit on an empty stomach first thing in the morning, believing that this cleanses or energizes the body. But for those over 40, especially those with any vascular sensitivity, eating fruit in isolation can sometimes spike blood sugar and contribute to metabolic stress. A better strategy is to pair fruits with fiber, protein, or healthy fat, like oatmeal with berries and nuts, or apple slices with a spoon of almond butter. This slows digestion, stabilizes energy, and supports hormonal balance. It's also wise to avoid excessive fruit juices, even those labeled natural or fresh. Juicing removes most of the fiber and concentrates the sugars, turning even a healthy fruit into a metabolic challenge. Whole fruits, eaten mindfully and in moderation, offer far more cardiovascular benefit than any juice ever will. What all this shows is that you're not powerless. You don't need to eliminate all fruits or live in fear of what's on your plate. Instead, you can use the knowledge you've just gained to make smarter, safer, and more supportive choices for your heart. The truth is, your body wants to heal. It's constantly trying to bring itself back into balance, but it needs your cooperation. Through every bite you take, every drink you pour, every habit you adopt or break. After 40, the rules change. The metabolism slows, the filters weaken, the margin for error becomes smaller. But your potential for healing and renewal remains enormous, as long as you give your body the right tools. Choosing the right fruits is one of the simplest and most impactful ways to begin that journey. So start small. Add berries to your breakfast, replace your morning fruit juice with a whole apple. Swap out exotic tropical fruits with heart-smart options like avocado and grapes. Over time, these small decisions compound. They clean your arteries. They steady your blood pressure. They protect your brain. And most importantly, they give your heart the strength it needs to keep beating, not just longer, but better. You have one heart. Take care of it. Before you take another bite of anything that enters your body, stop, not out of fear, but out of awareness. Place your hand on your chest. Feel the rhythm. That steady beat, quiet, loyal, and often taken for granted, is your one and only heart. It has no spare, no backup, no replacement, and yet every single day we expose it to decisions that either protect it or slowly chip away at its strength. What you've learned today isn't just about starfruit. It's about listening. It's about noticing the subtle signs your body has been whispering for years. The fatigue after breakfast, the pressure that fluctuates without reason, the irregular heartbeat you dismiss as stress. These are not random, they are messages. Most people wait until something breaks before they pay attention. A clogged artery, a silent stroke, a moment that cannot be undone, but you don't have to wait. You are here now, with a chance most people never get, to change your habits before it's too late, to make smarter choices, to choose fruits that heal instead of harm, to support your heart instead of silently challenging it every day. So here's what I'm asking you to do. Like this video, not just to support our message, but to help more people discover it through the algorithm. subscribe to this channel, because every week we share life-saving, heart-strengthening guidance that empowers you to live longer, stronger, and smarter. Share this video with someone over 40, someone who thinks they're healthy but hasn't stopped to consider how their body is changing with time. It could be the most important message they hear all year. And finally, pay attention to your own body. It's always talking. And when you listen closely, you realize that healing is possible. Clarity is possible. Prevention is possible. And a vibrant, energized, heart-strong life is still absolutely within reach, no matter your age. You have one heart. Give it the care it deserves. Start today while you still can.